Well, the White House opening the door this weekend to the possibility of a health care reform bill that does not include a government-run option. Health and Human Services Secretary Kathleen Sebelius saying it's really not essential. And then the White House tried to dial that back after many people in the liberal wing of the Democratic Party complained. Well, now some Democrats say if the government-run option is not included, this bill is essentially dead on arrival. Democratic Congressman Dennis Kucinich of Ohio is a big supporter of a government-run plan. He's my guest now. Good morning, Congressman.
How are you?
I'm fine, thanks. So tell us about this, because Kathleen Sebelius opened the door, and then we heard that many of the more liberal members of Congress put some pressure on the White House saying, what? The Congressional Progressive Caucus, the Congressional Black Caucus, specifically writing letters objecting, saying, don't say the public option or the government-run option is not essential. It is. Your position on it, sir?
Well, first of all, the public option that was offered in the bill wasn't much to begin with. The whole idea was it was going to encourage competition between insurance companies. So if you don't have that, that means there's no competition between insurance companies, and that means the costs are going to go up. So
and let me just clarify that before you finish your point. Meaning, in order to get the conservative blue dogs to sign on, they had sort of watered it down to the point where they were going to make the public option plan compete with private insurers when it came to rates. So that's why you say it didn't have a lot of teeth.
Right. There's not going to be any competition. So that means that the costs are going to keep going up. Just like the deal the administration made with the drug companies, where instead of reforming Medicare Part D, they let Medicare Part D continue to be siphoning money from Medicare. They're not going to have drug reimportation from Canada or other countries. Cost of drugs are going to keep going up. So what is all this about anyway, except the government subsidizing private enterprise? And I don't think government should be interfering in the marketplace. I don't think it should be picking winners and losers in the private sector, but that's exactly what this bill does.
So how do you get a bill that's meaningful through at this point? Because you've got the Senate, at least according to Kent Conrad, one of the senators who's part of this bipartisan group of 6 and doing the negotiating on their bill, says there's not going to be any public option in the Senate bill. The government-run health care is not coming out of the Senate. And you got Nancy Pelosi, Speaker of the House, saying we're not going to have a bill coming out of the House that doesn't have it. So how does this get squared up?
First of all, government-run is not government-run. When you talk about government-run, think veterans. Medicare pays the bills, but it's not a government-run system. What I favor is Medicare for all. That is, everyone's covered, because the insurance companies take $1 out of every $3 and basically right off the top take that money, put it into care, everyone's covered. Now what's going to happen right now, and what should happen actually, they should go right back to square one and go to the American people instead of trying to force down the throats of the American people a bill that no one understands, a bill that hasn't been well defined. We should go back and listen to the American people and their concerns about health care. And I think when we do that, the people are going to create the momentum that's needed to have a plan that's going to cover everyone. Because right now this thing has been bungled.
What do you make of these polls, sir, that show that the majority of Americans don't want the government messing with their health care insurance right now? That 80%, I think it is, of Americans are pretty happy with the health care plans as they have them.
I think it's a measure of how the issue's been mishandled rather than the underlying fact of people suddenly being in love with their premiums, their co-pays, their deductibles. Why, if you have a government trying to help lower the cost by having a Medicare for all, well, the next thing you'll have is a government-run government. My God. I mean, we really have to get some perspective on this. People don't have health care because they can't afford the premiums. They're underinsured because the co-pays and deductibles are driving them into the poorhouse. So, we've got to go back to the people, start over. They need to, if there ever was an issue, they needed to hit the reset button. This is it.
But let me just challenge you on that, because you're talking about what some might consider a relatively small faction of Americans who don't have insurance or who are underinsured. Because the research shows that the vast majority of Americans have insurance, and as I point out, that not only do they have it, but they're happy with it. And the argument people raise against your point is, why should we be messing with the entire system? Why can't we just siphon this down in a way that can help those of the number the administration uses is 47 million uninsured, and people say it's really not nearly that big. It's more like 15 million if you exclude the so-called invincibles, the 20-somethings who don't want it because they accurately deduce they're probably not going to need it, and you take out the illegals and so on. In any event, why can't we siphon it down just to cover the people who truly are most in need?
Are we or are we not one nation? The fact is that the insurance companies take one out of every $3, that everyone could be covered for the money that's already in the system. We're already paying for a universal standard of care. We're not getting it. And so the fact is that all these polls that have been taken are polls that are really based on the dynamic of the issue as it's been mishandled. When you have 47 million Americans, to use the administration figures, without any care, that's a drain on the rest of the economy. When you consider the fact that you, watching out there, are paying for someone else's health care in an emergency room, think of what happens when you start to emphasize primary care and everyone's covered. The cost goes down again. So we want to have a system that is sustainable, and that's what Medicare is. And I, of course, support H.R. 676. I'm the co-author of the bill, Medicare for All. That's the way to really control costs. That's the way to help business and industry in the United States finally give them an advantage that other countries have over businesses here by having health care costs driven down.
And I have to go, sir, but in a word, do you plan on voting for a health care bill in the House that does not have a government-run or public option?
That bill, as presently exists, is really not sustainable and can't be supported.
All right.
I don't intend on voting for it unless something dramatically changes.
Congressman Dennis Kucinich, thank you so much for coming on.
Thank you.
That would make him one of the